14,000 people in Polk County are in need of a second dose of the Moderna vaccine, and the wait could extend beyond that recommended 28 days. Good evening, I'm Erin Kiernan.
I'm Dan Winters. Thank you so much for being with us tonight. You know, both the Pfizer and the Moderna vaccines require 2 doses, and Erin, those have to be given 3 to 4 weeks after the first.
Polk County is struggling to meet the second dose timeline. Countywide, more than 43,000 people have received at least a dose of the vaccine. 21,000 have received both. That leaves nearly 22,000 people on the clock waiting to get the second. WHO 13's Dave Price joins us live outside the Polk County Health Department. And Dave, the county health department may not be able to deliver the second dose of the Moderna vaccine, at least in a timely manner.
Right, and there were already 2 factors working against counties all over the country here. That bad weather in the south delayed some of the vaccine supplies getting there. And then, of course, there's just the obvious that there's far more demand than supply. But there's now a third factor in Polk County. The Polk County Health Director essentially borrowed from future supplies here. So instead of setting aside the necessary doses of the Moderna vaccine for people's second shot, staff used that supply to vaccinate more people so they could get their first shot. So you could get more people vaccinated. The problem was that she expected the supply to increase in the future. That did not happen as much as she had hoped, and then ended up being 14,000 doses short for that second shot.
Drive-through clinics gave people in Polk County a convenient way to get a COVID-19 vaccination fast. They're part of the county health department's efforts to get residents immunized as quickly as possible. But the health director has now publicly admitted for the first time before the Board of Supervisors that she overestimated vaccine supply on the way.
That is, I guess, I'll own it, an error on our part.
A county health spokeswoman told WHO 13 that Director Helen Eddy allowed staff to use doses of the Moderna vaccine that should have been set aside for people's second doses to instead go to other people for their first dose. Eddy had hoped that future vaccine deliveries from the federal government would eliminate any potential shortfall, but she was wrong. Those future supplies never increased enough, and the county did not have those second doses set aside for 14,000 people.
In full disclosure, we anticipated and planned on there being enough doses and continued increasing doses of Moderna to backfill this. So we got ahead. That did not materialize.
The vaccine shortfall means that some residents will wait for first or second doses for at least several weeks longer than the director envisioned. And it adds to the frustration from local leaders who wish the federal government could increase Iowa's overall vaccine supply sooner.
So I don't get why we're left behind on our planning and how much we're getting. I just don't understand.
Here's what else we know at this hour. Polk County Health cannot say yet whether they also tried to do this with the Pfizer vaccine. They are looking at that right now, they said. Also, we know the county had asked the State Department of Public Health to give them additional vaccine to make up for the shortage. The state is not doing that because it would have to take away from the allocations already promised to the other 98 counties. Then this Saturday at Central Campus in Des Moines, there was already a mass vaccination clinic planned for 1,250 staff of the Des Moines Public Schools. At last check, that is still on. That was a partnership with Mercy One, and that's using the Pfizer vaccine. So both entities here say that vaccination is still happening. And finally, the shortage we're talking about, that of the Moderna vaccine, that is part of Polk County public health efforts. So for the other providers in Polk County, they are allowed to move forward as scheduled as long as they have the supply on hand. So bottom line with all of this, by essentially borrowing against its future supply, they didn't immediately have the 14,000 doses on hand and saved for these second shots. They're going to focus on that right now, get these people their second doses. They think they can have this figured out and caught up by April, but it's just going to slow the process. Everybody in the end should still be able to get vaccines. It's just going to take longer than they originally planned.
Yeah, it's so hard to plan and to know what to do because there are just so many unknowns and so much influx with all of this. Thanks for the update, Dave.